All right. Now let's talk about some of the symptoms for schizophrenia, so that when we see someone out there, we don't quickly judge and say this person is mad or this person is crazy, but look at those symptoms and help them, find help and find treatments.
Yes. I have said somebody who is suffering from schizophrenia, they seem to have lost touch with reality.
True.
But remember, we call that a psychotic episode, where you have lost touch with the reality, you have abnormal perceptions, so you perceive things other people can't perceive, like see or hear or feel things other people can't feel. Then in terms of thoughts, you might have delusions where like you think that somebody is following you, or you become suspicious, and these seem to be bizarre. Because like when you have depression, you could have delusions, but they are related to your mood. So you'll think thoughts which are you think, oh, supposing I have cancer, because you are depressed, you think everything is going to turn out negatively. I get cancer, I die, or I become those are mood concurrent delusions. But with schizophrenia, they tend to be bizarre. And we also have the negative symptoms where the person loses motivation, their affect is flat, they don't show emotions, and they don't they're not able to plan for their future and all that. So we have both positive and negative symptoms.
Yes. So what does positive mean exactly, or negative? Because when you talk about negative symptoms, someone might be like, oh, so negative, does that mean I do not have schizophrenia? The positive
that's
and
a medical term
and
we
cognitive.
use. That's a medical term we use. And positive means these are things which will distract other people. You will see. And you will, if I'm talking to myself, or like you said correctly, that I am not actually talking to myself. I'm conversing with somebody who is talking to me. There's a voice I'm hearing, and there are people I'm seeing. So I'm actually not talking to. So if I'm talking to myself, I appear to be talking to myself, or I become violent, or I become. Although not everybody who has schizophrenia becomes violent.
I was actually about to ask the same.
Yes, yes, or I have abnormal thoughts, which I seem to talk about bizarre things. Like somebody would say, I was not born, I just landed from the moon, and they believe that. So those are very bizarre things. So those are positive, are the symptoms which will actually maybe disrupt other people. But negative means that you're actually not moving on with your life. Like you are not showing any emotions, you are not planning for your life, you have no motivation. If you are left alone, you'll just sit in one place the whole day. So that's how we use the term positive and negative. Positive, it doesn't mean one is good. They are both equally very bad. I mean, equally bad, but the reason why we categorize like that is because the medications, if you have more of positive symptoms, then there are medications which will do better that. And if you're more of negative symptoms, there are medications which will do that. But I need to correct that. Having a first psychotic episode does not mean you have schizophrenia. There are people who will get a psychotic episode because they have used drugs, or they have maybe a tumor in the brain, or they have an infection which is affecting the brain. And that's why when you get a first acute psychotic episode, then we have to rule out all those. Are you using any substance which can make you psychotic? Are you having an infection? Are you having a growth in your brain, or is it a brain injury? So we rule out all that. We diagnose schizophrenia if you've had maybe the same symptoms for a long period, which ideally you shouldn't let somebody suffer for 6 months for you to diagnose. But if somebody is having the same symptoms, or recurrence, when somebody keeps recurring the psychotic episodes, and you've ruled out these other symptoms, then you can diagnose schizophrenia. That means even with the first episode, if you've ruled out these other causes, then you can start thinking, oh, this could turn out to be schizophrenia.
Yes. All right, so we address the positive and negative symptoms. What about cognitive?
Yes, I forgot about that. Sorry about that. Yeah, because that's why I said we now think schizophrenia is neurotoxic, because every episode, when somebody relapses, their brain functioning goes lower. So it also affects the cognitive function, the memory, the concentration, the motivation, the planning. So all that is also affected.
It's also affected, and this lies under cognitive.
Yes.
Okay. Now, when we talk about the first episode, and like we said, not every first episode, first acute psychotic episode, exactly means that this person has schizophrenia. So when it comes to the diagnosis for the same, what exactly happens? Like, how do you check out and rule out some of this to ensure that now we have ruled out everything else and we can ascertain that this person has schizophrenia?
Yes, it's a diagnosis of exclusion.
Okay.
So we will check out for substance use, we'll test for substance use, we will check for infections, we'll check for biochemical imbalances, we will check your brain, whether using a CT scan or an MRI, and we will check even hormones, like thyroid, like to just be sure. HIV has been very common, and if somebody is in the immunity is quite low, like they've taken long without being diagnosed and being started on treatment, we can have HIV encephalitis, which presents as an acute psychotic episode. So we need to rule out all those others
things,
before we can then tell this is schizophrenia.
Okay.